When you manage a patient presented with a first unprovoked seizure, the main concern for the physician and the patient should start antiepileptic medication or not. To answer these questions, you have to know some important facts. The first one, the risk of the seizure recurrences after a first unprovoked seizure range from 25 up to 41% according to the most studies. The great majority of recurrences occurring in the first 1 to 2nd year, and the greatest risk in the first year. So, if you see that the possibility to not get a seizure after the first unprovoked seizure higher than to get seizure. Second, a prior brain insult as a cause of seizure, abnormal EEG, abnormal brain imaging, associated with more increased rate of recurrence over 1 to 5 years. Third, immediate antiepileptic therapy as compared with no treatment is likely to reduce the absolute risk by about 35% of a seizure recurrences within the subsequent 2 years, but it's unlikely over longer term, 3 years or more. Fourth, the risk of antiepileptic medication adverse effect range from 7 to 31%. However, these adverse effects are predominantly reversible and mild. So based on this information, it's recommended to start antiepileptic medication after the first unprovoked seizure if the patient has abnormal brain imaging like cortical dysplasia, like mesial loop sclerosis or other structural brain lesions, or if the patient has abnormal EEG or abnormal neurological examination like tooth paralysis, like signs of cerebral palsy, signs of cognitive dysfunction. Also, it's recommended to start antiepileptic medication if the patient presented with a status epilepticus as a first presentation or nocturnal seizure, as also the risk of seizure recurrences in this situation are more. There are some relative indications to start to consider antiepileptic medication after the first unprovoked seizure, like a family history of epilepsy, the nature of the job, if the patient has the risk of significant injury if he gets seizure during his job, or the patient preferences, but after a good explanation of the risk of recurrences and also the risk of side effect of antiepileptic. Thank you.